There are certain physical changes that doctors and nurses recognize immediately. These are not small, everyday symptoms. These are powerful warning signs that often appear in the final days or weeks of life. The purpose of this video is not to scare you. It is to educate you. When families understand these signs, they can prepare emotionally, make better decisions, and focus on comfort instead of confusion. Let's begin. First warning sign: dramatic loss of appetite and thirst. One of the earliest signs doctors notice near the end of life is a sudden and complete loss of appetite. The person may stop asking for food, take only a few bites, refuse water, struggle to swallow. Families often panic at this stage. They try to force food, thinking it will restore strength. But in many cases, the body is naturally shutting down. The digestive system slows dramatically. The body no longer needs the same energy it once did. This is especially common in seniors with advanced illnesses like late-stage cancer, severe heart failure, or advanced dementia, such as Alzheimer's disease. In fact, near the end of life, forcing food can cause discomfort, choking, or fluid in the lungs. Doctors understand that loss of appetite at this stage is not starvation. It is the body conserving energy as organs begin to fail. Second warning sign: extreme fatigue and sleeping almost all the time. As the body weakens, energy levels drop sharply. The person may sleep most of the day, be difficult to wake, speak only a few words, drift in and out of consciousness. This is not ordinary tiredness. This is profound exhaustion caused by organ systems slowing down. The heart pumps less effectively. Oxygen levels may decrease. Blood circulation becomes weaker. Doctors recognize that when a patient becomes mostly unresponsive and sleeps nearly all the time, the body is entering its final stage. Families often think, maybe they are just resting. But when this sleep becomes continuous and interaction fades, it is often a strong signal that time is limited. Third warning sign: changes in breathing patterns. Breathing changes are one of the clearest signs doctors watch closely. There are several patterns that appear near the end of life. One common pattern is irregular breathing. The person may breathe rapidly for a few seconds, then pause for several seconds, then resume again. This is known as Cheyne-Stokes breathing. Another change is shallow breathing. The breaths become weak and quiet. Some patients develop a rattling sound when breathing. This is sometimes called the death rattle. It happens because the person can no longer clear saliva or mucus from the throat. For families, this sound can be very distressing. But doctors know it usually does not mean the person is suffering. It simply means the swallowing reflex is fading. Breathing changes are often one of the final physical signs before death. Fourth warning sign: cool, discolored hands and feet. As circulation slows, the body directs blood toward vital organs like the heart and brain. Because of this, the hands, feet, and legs may become cold to the touch, bluish or purplish in color, mottled with patchy patterns. This condition is called mottling. Doctors immediately recognize mottling as a serious sign. It usually appears in the last hours or days of life. The pulse may also become weak or difficult to find. The skin may feel thin and fragile. When blood pressure drops significantly and circulation fails, the body can no longer maintain warmth in the extremities. Fifth warning sign: mental confusion and withdrawal. Another major sign is a dramatic shift in mental awareness. The person may become confused, not recognize loved ones, speak about seeing people who are not present, withdraw completely from conversation. In some cases, they may talk about going home or seeing deceased relatives. This is not always dementia. It can be a condition called terminal delirium. As oxygen levels fall and toxins build up in the bloodstream due to organ failure, the brain becomes affected. Doctors know that when confusion suddenly worsens in a critically ill patient, it may signal that the body is shutting down. Some patients also become completely quiet. They may stop responding altogether, even though they can still hear. Many hospice nurses say hearing is one of the last senses to fade. That is why doctors encourage families to keep speaking gently and calmly to their loved one. Additional signs doctors watch for. Beyond these 5 major warning signs, doctors also look for sharp drop in blood pressure, irregular or weak pulse, decreased urine output, inability to swallow medications, loss of bladder or bowel control. When multiple signs appear together, doctors understand that the end of life is near. What families should do. If you notice these signs in a loved one, do not panic. Call the doctor. Contact hospice care if available. Focus on comfort rather than aggressive treatment. Hospice teams are specially trained to provide comfort, pain control, and emotional support during this stage. The goal shifts from curing to caring. Comfort measures may include keeping the person clean and dry, moistening the lips, adjusting pillows, playing soft music, holding their hand. The most important thing is presence. Many families later say their biggest regret was not understanding the signs earlier. When you recognize these warning signals, you can spend meaningful time together instead of rushing to emergency rooms unnecessarily. A gentle reminder. Not every senior who experiences one of these symptoms is dying. Fatigue alone does not mean death. Confusion alone does not mean death. Loss of appetite alone does not mean death. Doctors look at the full picture, medical history, underlying disease, and multiple symptoms appearing together. This video is for awareness, not diagnosis. If you are concerned about yourself or someone you love, always speak with a qualified healthcare professional. Final thoughts. Death is a natural part of life. For seniors, especially those with chronic illness, the body eventually begins to slow and shut down. Doctors recognize these 5 warning signs quickly because they have seen them many times. Now you understand them too. Knowledge removes fear, preparation brings peace, and presence brings comfort. If this video helped you understand senior health more clearly, share it with someone who may need it, because sometimes the greatest gift we can give is understanding.